What is disease X that scientists have warned about, and how is Singapore preparing for it? Is it the next big threat to public health?
From SARS to H1N1 and now COVID-19, Prime Minister Lee Hsien Loong said Singapore can apply lessons it's learned in managing the coronavirus to prepare for disease X.
Scientists talk about disease X being overdue. Disease X, a new disease, unknown, that is highly infectious, deadly, and mutates easily. So when COVID-19 appeared, people asked whether this was disease X. COVID-19 has been a disaster for the world, but it is not disease X. It is by far not the worst new disease that can befall mankind. But it is only a matter of time before disease X happens. So we had better learn from COVID-19 how to deal with a pandemic and be as ready as we can when the worst one befalls us. We should build up our resilience, our instincts, our preparations, so that when disease X comes one day, we will be prepared.
We're now joined by Senior Infectious Diseases expert at the National University Hospital, Professor Dale Fisher, to discuss this further. Welcome, Professor, to the show. Prof, as PM Lee noted in his speech in Parliament yesterday, COVID-19 is by far not the worst new disease that can befall mankind, and that scientists talk about a more potent disease X. Now, what is disease X, and under what situation or circumstance would we know disease X has arrived?
So let me just say, disease X doesn't actually exist, right? It's more of a concept that was brought about in 2018 through one of the WHO groups, and it was to, in a way, be a placekeeper for that concept of a very severe disease, high mortality, high transmissibility, something that could be mistaken for other diseases, something that could take advantage, if you like, of the globalization and the movement around the world now. So this was a concept that allowed for planning. Perhaps it was a wake-up call for countries to be a bit less complacent about what might happen. So this is why this concept of a disease X was invented.
Prof. Fisher, could you describe how damaging disease X would be should it happen, public health, but also in the sense of the social and economic impact?
Well, I don't think we need to imagine disease X. We can just imagine what we've got now, and we can see the massive disease from it. We can see the social disruption, the economic disruption, the health problems, and in many ways, in many countries, the way society is even turning on itself sometimes. So just imagine if this was worse. Imagine if it was more infective, perhaps something as infective as measles or chickenpox. And imagine if the mortality was 5% or 10%, it'd be completely devastating. So in that sense, I think the Prime Minister was referring to this not being disease X, because of course it could be worse conceptually, but in many cases actually it is disease X, because it is running out of control and there's many people dying.
Right. Well, there's the lingering threat of disease X. According to PM Lee, the current COVID-19 crisis serves as good preparation for us. Now, what lessons can we draw from this pandemic to manage, say, a more severe one?
Well, I think at the end of this, or even during it in some countries, it's time to take stock and look at your national response, how it could have been better, look how the global cooperation could have been better. And every international agency, every country really should be reviewing its activities and how it could have done better. I think Singapore has really been a standout. There's been obviously a major weakness exposed in the dormitories. And in that sense, it's fair to say, I think we dodged a bullet with the mortalities, because there was certainly a lot of transmission. But but very few deaths. So I think I think to look at that, we can look at the things we did well and other things that we probably could have done faster, could have prepared better for. There's no country or organisation in the world that's not going to learn a lot from this experience. And indeed, there's still a lot more to learn, things that we still don't know yet and problems that are still going to arise.